most individuals who are at average risk for colon cancer is completely preventable. What we do is perform, in the most common case, is a colonoscopy, which is a test that uses...
A colonoscopy is an examination of the lower gastrointestinal tract or digestive tract. The digestive tract is the system in your body that takes in food, absorbs its nutrients, and gets rid of waste. The lower digestive tract includes the colon and the rectum. This is where polyps can form. If left untreated, some polyps can develop into colorectal cancer. During a colonoscopy, your gastroenterologist or surgeon can see a detailed view of your lower digestive tract to correctly diagnose or treat any problems you may be having. Currently, colorectal cancer is the second leading cause of cancer deaths, but most cases of colon cancer can be prevented or successfully treated if detected early. Colonoscopy plays a key role. Average risk individuals should undergo colonoscopy at age 50. If you have a parent or sibling who has had colon cancer, you should have a colonoscopy 10 years before the age they were when diagnosed.
Because of your family history of colon cancer, I recommend you undergo a colonoscopy.
Talk to your healthcare provider about your risk factors and when you should have a colonoscopy to screen for colorectal cancer. Your doctor may also recommend you have a colonoscopy to check for and remove polyps, or if you have anemia, chronic diarrhea, blood in the stool, or inflammatory bowel disease. A colonoscopy is safe, but every medical procedure does involve some risk. Some of the risks include perforation or tearing of the colon lining, bleeding from removal of a polyp, infection, missed polyps, or you may have a reaction to the sedative medication. Make sure you tell your doctor about any allergies you have, especially ones to medication. Most patients and doctors feel the benefits of a colonoscopy far outweigh the risks. Properly preparing for a colonoscopy is very important.
What happens is the day before the test, you begin by consuming clear liquids, and we give you medicine to take to help clean out the colon.
In order to see the lining of the colon clearly and to avoid complications, your bowel must be completely empty. If it isn't, your doctor may not be able to perform the procedure. Ask what preparation method is best for you, and make sure you read and follow the instructions closely. Here are some general guidelines for colonoscopy preparation. Several days before your procedure, you'll be asked to start drinking more liquids in order to prevent dehydration. The day before your procedure, you may be asked to eat and drink only clear liquids. This means you can eat things like strained soup or bouillon, but must avoid solid foods. Also avoid clear foods that have red food coloring in them, like red Jell-O, sports drinks, and popsicles. You will take a laxative, pills, or a cleansing solution before the exam to completely cleanse your bowels. Laxatives and solutions will have to be repeated until there is nothing solid in your system. Talk to your doctor about what type of prep medication is right for you, and make sure to take the full prep ordered for you. When using laxatives and cleansing solutions, remain at home and close to the bathroom. In almost all cases, you will not be able to eat or drink anything several hours before your exam. Tell your doctor what medications you are taking, such as blood thinners or diabetes medications. He may ask you to stop taking them or change them a few days before your colonoscopy. On the day of your colonoscopy, arrive at the hospital or your doctor's office wearing comfortable clothing. Have someone come with you to drive you home. Before the procedure, you may have to take off any jewelry, and you will put on a hospital gown. Your doctor will ask you to sign an informed consent form before the procedure, explaining that you understand the procedure and any risks involved. You may be given fluids through an IV needle in your arm. Your blood pressure and pulse will be checked and monitored throughout the procedure. You may be given extra oxygen throughout the examination. Medication is given to you through the IV needle in your arm. The medication will make you sleepy and relaxed. As you become sleepy, you will be asked to move to your left side. A rectal examination is performed to look for problems with the anus or rectum. Your doctor will use a thin tube called a colonoscope to see inside your colon. The colonoscope is lubricated and the tip of the scope is gently inserted into the rectum. Air is pumped in to inflate the colon. This keeps the colon open, giving your doctor a clear view while the tube is carefully guided through the bowel. The colonoscope has a tiny camera and light on one end that sends pictures back to a video screen to show the lining of the colon in detail. Your doctor will look at the lining of your colon thoroughly as the scope travels to the beginning of your large intestine. The beginning of the large intestine is called the cecum. After the cecum is reached and examined, the scope is slowly removed and the bowel is carefully inspected. This is a video taken during a colonoscopy. As you can see, your doctor will have a clear view of the inside lining of your colon. If your doctor sees any abnormalities in your colon, he can thread tools down through the scope to take tissue samples or even remove polyps so they never have a chance to develop into cancer. If a polyp is found, your doctor may perform a painless procedure called a polypectomy. He can remove it completely with metal forceps or a thin wire snare. The snare is placed around the base of the polyp and tightened until the polyp is cut off. If bleeding occurs, he has tools available, including clips, to stop the bleeding. Or a mild electrical current is used to stop any bleeding. Polypectomies are often performed during colonoscopies. Any tissue that is removed is then sent to a lab, where the tissue sample is examined using a microscope. Your colonoscopy should take between 15 and 45 minutes to complete. After your colonoscopy, you'll be moved to recovery. Because of the medication, you may feel sleepy for the next 8 to 12 hours, and you may not remember what happened. Even if you feel awake, your judgment and reflexes are slowed. You must have someone drive you home after the procedure. Do not return to work, drive, operate machinery, drink alcohol, or sign legal documents until the next day. Because air was pumped into your colon, you may feel bloated, have mild cramps, and gas. You will feel more comfortable if you expel this gas. These minor side effects should go away within 24 hours, but if they don't or if they become more severe, call your doctor. Although complications from a colonoscopy are rare, it is important to recognize early signs of possible problems. Contact your doctor if you notice severe abdominal pain, fever and chills, rectal bleeding, or redness or pain at the IV site. Your doctor will discuss the results of your colonoscopy following the procedure. If any tissue samples were taken, your doctor will contact you to review the results once they become available. Your doctor will give you instructions on how to care for yourself when you get home, including what medications to take. Don't overdo it. Start out eating lightly and gradually increase the amount of food you eat. A colonoscopy is a procedure that is necessary to protect your health today and in the future. Because with regular screening, you can be confident that any problems will be detected before they become too serious.